that is also known as laryngotracheobronchitis. Inflammation of the larynx, trachea, and bronchi. Most common type of croup may be viral or bacterial and most frequently occur in children younger than 5 years. Common causative organisms include parainfluenza virus type 2 and type 3, respiratory syncytial virus, mycoplasma pneumonia, and influenza type A and type B. So let's move further. Croup, that is also known as laryngotracheobronchitis, the most common form of acute respiratory obstruction, acute upper respiratory obstruction, inflammation of the upper airway. Epidemiology: age 3 months to 3 year preschool kids, season in winter or in the fall autumn. Causes: as we have know that parainfluenza virus, that is RNA virus, adenovirus conjunctivitis, respiratory syncytial virus are the causative organism that can cause the laryngotracheobronchitis. Clinically, hoarse barking cough, barking seal cough, especially at night, inspiratory stridor are present in the child that has suffered from croup. A child who is hypoxic, cyanotic, pale, or obtudent intubation. Okay, complication: upper respiratory obstruction and asphyxiation. Diagnosis: clinical, mainly best in initial test: X-ray of the neck, steeple sign, subglottic narrowing. When X-ray is conducted and there is a subglottic narrowing are shown in the X-ray, that means it's a sign of laryngotracheobronchitis, that is also known as croup. Most accurate test is PCR, polymerase chain reaction, rarely needed. Treatment: we can provide cool humidified air, dexamethasone, that is corticosteroid, and corticosteroid is acting as a reduce inflammation, and racemic epinephrine. Okay, so differential diagnosis of croup: acute epiglottitis, foreign body inhalation, subglottic stenosis, angioedema, retropharyngeal abscess, bacterial tracheitis. So in that case, try to rule them out first before you diagnose croup. So before we diagnose the child has suffering from croup, we have to identify, we have to rule out the foreign body inhalation, subglottic stenosis, acute epiglottitis, angioedema, retropharyngeal abscess, and bacterial tracheitis. So in further interventions, I can say that we have to maintain the airway patency first, then after assess respiratory status and monitor pulse oximetry, monitor for nasal flaring, sternal retraction, and inspiratory stridor, monitor for adequate respiratory exchange, monitor for pallor or cyanosis, elevate the head of the bed and provide rest, provide humid oxygenation via a cool air and mist tent as prescribed for hospitalized child, instruct the parent to use a cool air vaporizer at home. Other measures include having the child breathe in the cool night air or the air from the open freezer, or taking the child to a cool basement or garage. Provide and encourage fluid intake. IV fluid may be prescribed to maintain hydration status. If the child is unable to take fluids orally, administer analgesics as prescribed to reduce the fever. Then teach the parent about avoid administering cough syrup or cold medicines which may dry and thicken the secretion. Then administer corticosteroid as I already told you to reduce the inflammation and edema. Administer antibiotic as prescribed, noticing that they are not indicated unless bacterial inflammation is present. That means avoid administration of antibiotic unless it's necessary. Heliox mixture of helium and oxygen may be prescribed. Administer nebulized rhythmic epinephrine as prescribed. Have resuscitation equipment available, provide appropriate reassurance and education to the parent and caregiver, and remember that isolation precautions would be implemented for a hospitalized child with an airway obstruction or upper respiratory infection until the cause of the infection is known. So, from the first group is also known as laryngotracheobronchitis, and causative organism is parainfluenza virus and respiratory syncytial virus. Then inflammation of the upper airway occur in mostly 3 months to 3-year old child, that is preschool kids, and occur in the season of winter months. Causative organism parainfluenza virus, adenovirus, RSV, that is a respiratory syncytial virus. Clinically, in the sign and symptoms, we have noticed the barking cough, hoarseness of the voice, and inspiratory stutter. Then complication, upper respiratory obstruction, diagnosis mainly X-ray, and rarely PCR is conducted. And in treatment, dexamethasone, epinephrine, and humidified air must be entered.